Well, cancer is a term that's used to define when the growth of cells in your body is abnormal, so it's not the same as what would usually be. What happens is that the cells expand and form a tumour, which some people often have heard of. If the tumour is able to spread to the rest of your body, it's called a malignant tumour, and that's what's commonly referred to as cancer. It's quite an emotive term because I think most people have got friends or family who have suffered from cancer, and seeing the journey that the patient goes through, I think it's important to realise that cancer is not a single disease. There's actually over 200 types of cancer, so there's 200 different types, kinds of cancer and sites where it can be, and also treatments. Well, in the UK, about 250,000 people each year are diagnosed with cancer, so it's a significant number. You would have heard the statistic, 1 in 3 people. So 1 in 3 people across their lifetime will have a diagnosis of cancer. So what it really means is that all of us have family or friends who are going to suffer from cancer. In men, the top 3 cancer sites are the prostate, the large bowel and lung cancer. In women, it's quite similar, but breast cancer, large bowel, the lung, and also ovarian cancer are the top cancer sites. Well, there's a lot of causes for cancer, and there's no one single cause. What we do know and is quite common is that smoking is quite a big factor and contributes towards some of the largest sites of cancer. And most people are aware of lung cancer as being linked to cigarette smoking. Other lifestyle factors, such as if you're overweight and obese, excessive fat can be linked to different types of cancer. Also excessive drinking of alcohol, also lack of exercise, and specific cancers have different causes. So, for example, if skin cancer may be related to excessive sunlight and UV rays. So really quite a lot of different factors. Similar to, because cancer is so widespread and different in different parts of your body, the symptoms can also be very different for different people. I think what's really important is that if it's something that's not normal to you, so if you notice a change in your body, that you discuss it with your GP, because they're the best person to help you work out what that might be. If some different symptoms might be that you have a lump that you don't normally have and it's unexplained. You may notice change in your bowel habit. You may have some bleeding that's not normal. You may have unexplained weight loss, so you haven't been on a diet but you notice that you're losing weight. So it's things like that that you notice aren't quite right, and obviously therefore you need to talk to your GP about those. The diagnosis is usually done obviously via your GP, and you may be referred into hospital for a specialist consultant. A diagnosis is usually done via biopsy. So what that is that they actually take a sample of the tumour that I mentioned before, of the cells that are cancerous, and they look at those under a microscope, and if those cells are abnormal, they may be diagnosed as cancer. Well, the treatment options also vary, and there's a number of different treatments, again depending on the different sites of cancer that you may have. The 3 most common treatments may be surgery, so obviously a surgical operation in which to remove the actual tumour and the growth. You may also be referred for radiotherapy. Radiotherapy is when you have high energy X-rays targeted towards where the tumour or the growth is in your body, and that helps eradicate or destroy those cells. Or thirdly, you may be given chemotherapy, and that's taken drugs, and they actually sort of target the cancerous cells in your body, again to destroy those cells. And each of the different treatments, it really depends on what cancer you have. And you may actually have a blend, you may actually have all 3 of those different treatments, depending on what your consultant or your specialists advise for you. Nutrition comes in when it's sort of, in the symptoms, and you may have excessive weight loss. So it's really helping that person, hopefully, in the first instance, stop losing more weight, and secondly, to try and regain some of the weight that's lost. It's also part of the well-being, in that you maintain your nutrition and your food intake to help sort of keep some normality within your life. When other things seem to be going out of control, that food is something that you can control, and helps you maintain something that's usual for you. I think also there's a lot of evidence to support that if you can keep good nutrition, maintain your weight, it also helps you go through the treatment options. As you can imagine, some of the treatments do have side effects. For example, radiotherapy, you can feel very tired and lethargic. Chemotherapy, you can sometimes have nausea and vomiting. By keeping up with good nutrition, you can help maintain your energy levels, and they help you sustain yourself through the different treatments. Certainly recent progress has been made. An awful lot of research has gone into looking at different types of treatments. So there's a number of different options, and some of them are very positive and actually cure the cancer. So yes, it's not always a life-threatening diagnosis as it used to be perceived, and certainly the different types, some of them have very strong cure rates.